I know most of us are expecting to hear the salaries are tied to these positions.
That statement from Sarah Serem during the release of the job evaluation results rang true for a section of professionals in the public service.
Solidarity forever.
Medical practitioners, dentists, and pharmacists.
For the union makes us strong.
It is an answer they have been waiting for since 2013 when they started agitating for a pay hike.
For the last 2 years, we've been told to wait for a completion of a job evaluation exercise, hoping that the Salaries and Remuneration Commission will advise our employers on exactly what doctors ought to earn in this country.
And when the results were out, they were a disappointed lot.
What we expected yesterday, among other things, is for the Salaries and Remuneration Commission to come very clear with figures on what exactly doctors need to earn in this country.
Why are they not telling us how much we should be able to earn? Because even SRC is ashamed of how much this country is paying their doctors.
According to the doctors, their struggle for a pay rise has already been decided by the courts, which awarded them a 300% pay hike. It is this amount that the doctors are now demanding from government in the next 20 days, failure to which they will down their tools.
December 2016, if these figures will not be paid for doctors, if the Salaries and Remuneration Commission, the Ministry of Health, the county governments, Kenyatta National Hospital, MTRH, and every single program where doctors work at the public sector will not agree as the court demanded, will not agree as we agreed and signed then to pay doctors these amounts of money, which equates to 300% salary increase, we shall proceed on a national strike.
And we have agreed in principle, come December 5th of 2016, KMBDU will engage in a nationwide industrial action to ask for their worth, to ask for their right.
The doctors maintain that their profession is amongst those that have been undervalued for a long time by the government, subjecting them to a life of indignity, a situation they want changed immediately.
The basic salary of a doctor still remains 40,000 Kenya shillings. I am sure you are all aware that even hairdressers are now sympathizing with doctors on what we earn. And we agree.
A doctor in Kenya is paid 70 shillings per hour. 70 shillings per hour. That is what the government of Kenya pays the doctors. After 6 years of training in undergraduate, 5 years in master's program, seeing 100 patients per day.
In releasing the job evaluation and grading, the government had aimed at ironing out some of the salary contentions within the civil service. The medical professionals were amongst public servants that were expected to gain the most from the revised grading system that, amongst other things, took into consideration the skill set, the experience, and the time taken to gain the skills in setting the salaries.
Teachers, doctors, nurses, police, and other civil servants provide critical value service to our people. They therefore need and should be fairly remunerated. But this should be based on an objective and scientific assessment.
It would appear that the job evaluation exercise has had the exact opposite impact that Salaries Commission had hoped for, that of averting strikes in the country, as the doctors now say, come the 5th of December this year, they will be downing their tools, demanding for better pay. Brendas Wanga, NTV, Nairobi.